cancer can actually be more aggressive in a younger woman?
Although incidence is lower in a younger woman, it tends to occur in the older woman. But when it does happen, it tends to be larger. It tends to be more aggressive. Because they don't present for screening the way the older woman does, it tends to be at an advanced stage. Breast cancer in a younger woman is a whole different entity. I was asking my daughter the other day, who's 21, I said, Hannah, are you aware of your breast cancer risk? And she said, I have no idea. I think doing what you're doing, what we're doing, just talking about it, being really aware of your own health, your family history, and what your risk is in terms of what you can't change. So if you have many relatives on one side with breast cancer or even ovarian cancer, then you can't change that risk. Another thing to do would be to modify some risk factors that we can, so some lifestyle factors. I guess the most important thing would be to be breast aware. So to check your own breasts once a month, every month, we do this check. Get help if you find something. We want to do it smack in the ovulation time, which is about 2 weeks before or 2 weeks after. During one's periods, the breasts are enlarged, engorged, tender, painful. If you go in between your monthly cycle, that's the time to know what your breasts feel like normally. And we're trying to do this not to create anxiety, just to know what's normal. Predominant cause of a mass is a benign cause. I felt one too when I was working at the Breast Cancer Institute. I was examining so many women and dealing with cancer so much that I felt, gosh, I have a lump, and I went through the whole thing and there was nothing there. It's important to do the check. If you find it, and if you find it really early, that makes all the difference. So I've got a little prop. You want to take off all your clothes, of course. Look at yourself in the mirror, front and side, with your arms in the air, by the side, just making sure everything looks the same. And then you go on to examine the breast per se. So I'll show you on this model here. Just on looking, you can already see the differences. Now, in that video, I talked about mass or a lump, and I talked about nipple discharge, but I'll qualify that a little bit and say any nipple change. So this model, I can actually, I don't know if you can see that, but I can pull that in. And you can see how there's a bit of a retraction there. So the nipple being pulled inward, that's a sign of something wrong that needs to be checked. And once you've had a look, everything looks okay, then you can check either all around, from out to in or in to out. You can go up and down. Let me try and get there. Up and down.
Yep.
Or like the pages of a book. And you're always using the 3 pads of your finger to check. And once you're done with the breast, don't forget the underarms, the armpit, and the other side. Initially, it feels really weird. Everything feels like a lump, perhaps. Doing it monthly is when you really get a lay of the land and you know what your body's meant to feel like and look like.
So if you did find something, you would go straight to your GP, I'm guessing, make an appointment, and then the GP would send you off for further tests. Is that the process?
I try and teach my patients about the triple test. Triple test is, first part of a test is an examination by your doctor. So your doctor examines you, feels the lump or not, and then sends you for imaging. Now, for a younger woman, like you mentioned, it might be an ultrasound, not a mammogram first. Might still be followed by a mammogram and might still need further imaging. And finally, if there is something, that's when we need a biopsy, so a needle test. And those 3 things, an examination, the imaging, and biopsy. Those 3 things are the triple test. It's a must to check, and then you can give yourself a tooth mask.
Yep.
Julie, when I was a younger breast surgeon, and I tried to convince a lady to go for her mammogram. Keep in mind, I was way before the time for mammogram for myself. She was not happy. She said, you have no idea how painful it is. And I liken it to colonoscopies and the bowel prep, you know. Those of us who haven't done it may not feel the pain of those who have. So yes, what I'm trying to do is pain, the perception of pain. Now it's not as painful as it used to be, but it's still an uncomfortable exam.
Can I say from my own experience that the fear of the unknown pain was much worse than the actual pain? The first time it seemed to just be less intimidating the following times.